Hi everyone. Let's start today's topic about intrauterine infections. Infection diseases and processes that cause pathogens that have penetrated to the fetus from an infected mother to childbirth or the passage of the child through the birth or during the delivery may be transmitted from the mother to baby. It's called intrauterine infections. And you should know about torch abbreviatures, otitis, cytoplasmosis, or other virus and bacteria are rubella, cytomegalovirus, H. herpes virus. There are 4 ways of transmitting this infection from the mother to baby: the ascending pathway, the transplacenta, the descending pathway, and a mixed path. What about etiology? Viruses, mycoplasma, chlamydia, bacteria, and the simplest, all protozoes. Pathogenesis depending on the timing of infection. If embryos only have an alteration reaction, so early fetal alteration and proliferation. What about late fetal alteration, proliferation, and post-vascular component of inflammation will be seen. Pathogenesis, here you can see the placental insufficiency, fetal hypoxia, premature birth, and also formation of stigmas. Risk factors. There are many risk factors, including during delivery, before, after, and what about clinical manifestation? It is very various in common symptoms: decreased appetite, hypertrophy, delayed weight gain, lethargy. What about hemorrhagic rash? Also will be seen. Respiratory disorders, including tachypnea, shortness, apnea, cyanosis, cardiovascular hypertension, will be seen. Tachycardia, increasing size of the heart, arrhythmias, GI tract, hepatosplenomegaly, vomiting, regurgitation. In nervous system, you can see brain cry, like in meningitis, yeah, or also you can see depression, agitation, convulsion. Hematological disorders including thrombocytopenia, anemia, hyperbilirubinemia, leukocytosis, sometimes leukopenia, will be seen. And what the site of examination for suspected intrauterine infection is a general blood test with platelet count, general urine analysis, determination of total protein fraction, and C-reactive protein, bilirubin, also enzymes of the liver, also neurosonography, examination of ophthalmologist, bacterial or bacterioscopy, and spatial diagnostic method. What about viral infections like herpes? Effects on the fetus and mother. Herpes type 2 virus will be seen in 0.51% of women during pregnancy have active herpes, but the virus can be reactivated even with persistent immunity. Effects on the fetus is very rarely, but if the virus enters through the placenta, several fetal developmental disorders occur in the form of microcephaly, and the retardation of fetus is not protected by maternal antibodies. You can see the rash characteristically for herpes virus. And diagnosis commonly will be seen in virological examination and sometimes changes in the titer of specific immunoglobulin M, G, and treatment including acyclovir. And for newborns also acyclovir, but the dosage is changes like 50 milligrams per kilogram per day and administered every 8 hours. Cytomegalovirus. It is DNA virus, also from the herpes families, and you can see that if the primary infection occurs during pregnancy, then 40% of children are affected. So primary infection causes specific changes in a small child: microcephaly, intracranial calcification, hemolytic anemia, jaundice, thrombocytopenia, and hepatosplenomegaly. Hearing loss also will be seen. What about rashes? Characteristical rashes and characteristical changes in X-ray of the chest. You can see carditis and retinopathy in these babies with cytomegalovirus congenital. And serial examination serological method detects the increasing of the levels in hemoglobin G in hemoglobin M titer, and treatment also cytotech 2 ml per kilogram intravenously every 2 days. 5-6 injection is enough. What about viral infections? Rubella. Rubella teratogenic effects to baby in the first 12 weeks, 80%, and with increasing gestation period, the probability of fetal damage decreases. And the changes or development of any abnormalities depending on the in which age or in which weeks baby was affected. And remember about Greek tribes. And you can easily connect with mnemonic signs like person who falls in love. What it means? If someone falls in love, this person loves with heart, and he is not able to hearing someone or looking at someone else. So in Greek strides also you can see cataract, congenital heart defects, and deafness, which characteristically the person who falls in love. So you can easily remember about it. And thank you for our government. Now, today's we have prophylactic or vaccination of this virus. What about viral infections, rubella? Also, it is a clinical sign. And diagnosis also serological examination and pathology treatment only symptomatic. What about hepatitis B? You know that it is causes of many chronic diseases. I mean, liver cirrhosis and another types of diseases. And you know, clinical manifestation hepatitis will be seen jaundice, hepatosplenomegaly, general malaise, late physical development, weight gain. Also will be seen changes and cirrhosis of the liver. So there are forms of the hepatitis in newborns. And what about HIV? HIV also you can see in babies. It's transmitted vertically from the mother to baby during the delivery, maybe. And C-section can reduce the risk of infection if the fetal membranes are intact. Remember about it. There are the treatment like by antiviral drugs. Dosage, remember about dosage also. I think it was about HIV infections. What about syphilis? Syphilis also manifests on the skin and genitals in mothers, yeah, and in babies also. You can see the characteristical changes like the splenomegaly, jaundice, skin damage, petechia, pulpus, spotty redness of the skin, lungs, heart, lymph nodes, kidneys are affected during this disease. Yeah, you can see characteristical changes or clinical changes in syphilis. And what about diagnosis? Serological examination and mother's treatment also by penicillin. But in babies, commonly we use ampicillin and gentamicin. Chlamydia is an intracellular bacterium more common in cells of the transitional epithelium. So this affects on the fetus and mother. In a newborn, it manifests itself as neonatal conjunctivitis, remember, which can be complicated by blindness. And pneumonia is characterized by bilateral infiltrates, chronic cough, sluggish weight, dynamics. You can see pneumonia, atypical pneumonia, characteristic of chlamydia. And diagnosis positive in secretions. And what about treatments? Newborns erythromycin, 40 mg per kilogram every 6 hours. About toxoplasmosis. Parasitic infection, toxoplasmosis, you can see in baby accumulation of the liquid in brain, so hydrocephalia, increasing size of the head you can notice in these babies. And this diagnosis also serological treatment including sulfasalazine and pyrimethamine. Sometimes we can use steroids and folic acid. Thank you for attention.